How's it going, guys? We have a past level question for Immuno dermatology. 46-year-old woman. She's got pemphigus vulgaris, and there's two reasons that we know that. Number one, she's got an intraoral lesion, which is very classic for pemphigus vulgaris in comparison to bullous pemphigoid, in which you do not usually see oral lesions. Are they possible? Yes, but when we're talking about not overthinking dumb shit, it's pemphigus vulgaris that has the proclivity for intraoral lesions. Number two, we've got a positive Nikolsky sign here, which is sloughing of the skin with friction. Okay, sloughing of the bullae / skin with friction. Now, see this in pemphigus vulgaris, not bullous pemphigoid. If we had given you the same vignette here and they told you that a drug such as trimethoprim sulfamethoxazole was given, the diagnosis instead would be SJS/TN, Stevens-Johnson syndrome, toxic epidermal necrolysis. Okay, so SJS, under 10% of the surface area of the skin involved, greater than 30%, it's TN, 10 to 30 is a mid-zone. But regardless, we have what looks like just a passable vignette of pemphigus vulgaris. What part of the skin is involved here? Should I say tight junctions? Wrong fucking answer. Now, you can know weird factoids, such as they're composed of claudins and occludins, but I'll tell you what they want you to know for USMLE. So these prevent the movement of liquids / solutes between cells. And the way they're going to ask this in USMLE is they'll say a patient with Crohn's disease versus a normal patient have radio-labeled contrast injected per rectum. And in the patient with Crohn's disease, it shows up in the blood, but in the normal patient, it doesn't. And then they wanted to know which skin component or mucosal component is fucked up. And the answer was tight junctions for that question. So presumably because you have inflammation, increased spacing between the cells, and the tight junctions aren't cohesive the way they're supposed to for the cell-to-cell contact, that's why you had the contrast showing up in the blood in Crohn, but not in the normal patient. Wrong fucking answer. Choice B, the zonal adherence, the adherence junctions. Wrong fucking answer. So, I mean, really, not much you need to know. You could be aware of weird factoids, that they're calcium dependent, composed of cadherins. Okay, I mean, there are factoids that I discuss in my dermatology PDF that for the numerical step 1 mattered more. Wrong fucking answer. Choice C, Desmosomes, correct answer. So you say, well, they kind of look the same. I mean, it's a cartoon little illustration here. Like, we really need to know this is C? The answer is yes. Okay, I mean, there's one of these weird illustrations in black and white on one of the NBMEs floating around somewhere, and they recycle questions. And the third one down is the Desmosomes. Okay, so these are composed of desmogliin. Okay, 1-3, doesn't matter. It's just you can be aware of desmosomes, desmogliin, and we have antibodies directed against desmosomes, pemphigus vulgaris. That can cause a net-like immunofluorescent pattern as well. Okay, and then tangentially, if you add staphylococcal scalded skin syndrome, you can also have problems with the desmosomes, desquamation. Okay, so desmosomes for pemphigus vulgaris, it's pass level. Okay, side-to-side contact between the cells. And let's just hop through the final ones. Choice D, gap junction. Wrong fucking answer. You can be aware that they are composed of connexins. It's the name of the protein. They allow for ions to move between cells. The way it can show up in USMLE, actually, there's two ways that it can show up. Number one, on an old NBME, I think it's like NBME 3, okay, old offline NBME, they have an electron micrograph of a gap junction, and the answer was literally gap junction. Like, you were supposed to somehow know that image. Back in the numerical step 1 days, we used to like freak out about shit like that, okay, but that's one way it shows up literally. And then the second way is just they want you to know that electrical synchronization within myocardium is due to gap junctions. Okay, so ions moving between cells. That's what allows for electrical conduction within the heart. So gap junction is an answer there. Wrong fucking answer. Choice C, the Hemidesmosomes for bullous pemphigoid. Wrong fucking answer. So now I've seen on the NBME exam a bullous pemphigoid question, and then the answer was just like wrong answer, for instance, was desmosome, and then the correct answer was bullous pemphigoid antigen, literally, is what they had as the answer. Okay, so there's different collagen types of the hemidesmosomes, but just be aware, hemidesmosome, and it secures / fastens the dermis to the epidermis at the basement membrane. Okay, so they can also give you another factoid, which is they can tell you for pemphigus vulgaris that there's intraepidermal blisters, whereas for the hemidesmosomes for bullous pemphigoid, they can say subepidermal blisters. I don't really know what to tell you. I mean, I'm just giving you details that can sometimes be seen in questions. And in contrast to the net-like immunofluorescence of pemphigus vulgaris, the desmosomes, desmoglein proteins, in bullous pemphigoid, you have linear immunofluorescence because you're at the basement membrane. Bullous pemphigoid? Wrong fucking answer. You know the deal. To make more content on my subscribe channel. Appreciate your time. That's it.